We know that diabetes affects morbidity and mortality for almost every cardiovascular disease, and often for cardiovascular procedures too. And in fact, it may be one of the reasons why someone might end up with CABG as opposed to PCI. Well, what about aortic stenosis? We're talking about TAVR versus SAVR for diabetic patients with AS, and I'm with Dr. Suzanne Arnold, St. Luke's Mid-America Heart Institute and the University of Missouri, Kansas City. This is from the March 25th, 2014 JACC lineup. First off, thank you very much. This is an interesting paper because we're aware of diabetes and its impact on so many different areas. In this area of aortic stenosis, what did we learn?
Well, I think this was a really interesting study. We knew that diabetes was associated with increased mortality with surgical valve replacement from prior studies. And now that we have transcatheter valve replacement, it's less invasive, we wanted to look at whether or not diabetes had a similar effect in transcatheter valve replacement.
Now, this is a partner sub-analysis, correct?
Yep. This is from the Partner 1 trial, so the original Partner trial, and Cohort A, which compared transcatheter valve replacement versus surgical valve in high-risk patients.
In general, what did you find?
What we found was that there was a significant interaction between diabetes and transcatheter valve replacement. So patients that had diabetes did better with transcatheter valve replacement than they did with surgical valve replacement. And this was not something that was found in the overall trial. In the overall trial, the results of the two interventions were similar. Right. So this was kind of an interesting result that we found.
So you're saying there's kind of a diabetes paradox. Do you have any idea why? What might the mechanisms be for this?
This study certainly wasn't designed to identify what those things were, but I think some of the signals that we saw were that there was more renal failure in the surgical valve patients that had diabetes, and it may be that the bypass and the cardioplegia that is required for surgical valve replacement is more deleterious in patients with diabetes that have this underlying inflammatory state and have a lot more hypertrophy, and so the bypass just really is more hurtful in patients with diabetes, whereas the less invasive approach of the transcatheter valve replacement can be more beneficial in those patients.
So while there are a number of variables that may depend on whether you're going to go with SAVR or TAVR, in this case, don't necessarily let diabetes be one that sends you immediately to surgery.
I definitely wouldn't automatically send somebody to surgery because they have diabetes, and this might be a signal that they may benefit even more from a less invasive approach. Now, certainly, I think one of the big limitations of this study was that it was post-hoc analysis. Yeah. So I think we have to consider these hypothesis generating, and will need to be further explored prospectively. But I think it really is an exciting finding that this effect of diabetes that we've seen with surgical valve replacement, where they certainly do worse, we may be able to improve their outcomes with a less invasive approach.
And the patients might certainly appreciate a less invasive approach.
Of course. They really like to be on their feet faster. They like to recover faster. I'm sure they appreciate that.
Well, TAVR is one of the more interesting stories of the last decade, probably. So make sure you check out this particular paper by Dr. Arnold and colleagues, TAVR versus SAVR for diabetic patients with AS, and it is in the March 25th, 2014 issue of JACC. For Cardiosource World News, I'm Rick McGuire.